Joint pain in people in their 50s is common and often linked to the natural aging of the joints. This condition can arise from various factors, such as osteoarthritis, which is a gradual wearing down of the cartilage that cushions the joints, leading to pain and stiffness. Other contributing factors include previous injuries, overuse of certain joints, or underlying health issues like rheumatoid arthritis and autoimmune disease. These joint pains can significantly impact daily life, making simple activities like walking, climbing stairs, or even getting out of bed difficult and uncomfortable. Reduced mobility may follow, leading to a sedentary lifestyle, weight gain, and increased pressure on the joints. Maintaining a healthy lifestyle is crucial for managing these pains. This includes low-impact exercises, a diet rich in anti-inflammatory foods, and maintaining a healthy weight. Certain oils and plants can also help reduce inflammation and improve joint health. In this video, we will explore 5 anti-inflammatory oils for relieving joint pain and 3 of the best herbs that are easily available. Don't forget to subscribe to our channel, watch the video until the end, and give it a thumbs up. Let's start with the first oil, extra virgin olive oil. This oil is a powerful natural remedy, particularly beneficial for people over 50. Rich in monounsaturated fats, it has anti-inflammatory properties due to a compound called olacanthal, which works similarly to non-steroidal anti-inflammatory drugs like ibuprofen by inhibiting the activity of cyclooxygenase responsible for inflammation and pain. Extra virgin olive oil offers these benefits without the side effects associated with long-term use of medications. Regular consumption of extra virgin olive oil has been shown to reduce stiffness and joint pain, especially in cases of osteoarthritis. You can use it as a salad dressing or drizzle it over vegetables to enjoy its long-term anti-inflammatory effects. In addition to its culinary uses, extra virgin olive oil can be applied topically. When massaged into the skin, it penetrates deeply, reducing inflammation, improving circulation, and providing immediate pain relief. Extra virgin olive oil is a versatile and highly effective solution for relieving joint pain. It can be used both in your diet and as a topical treatment. By incorporating it into your daily routine, whether in your meals or through relaxing massages, you can maintain the health and mobility of your joints. Another excellent remedy for joint pain, especially for those experiencing age-related discomfort, is eucalyptus essential oil. Extracted from eucalyptus leaves, this oil is known for its refreshing scent and powerful anti-inflammatory and pain-relieving properties. Its main active ingredient, menthol, provides a cooling sensation when applied to the skin, reducing pain and stiffness. This cooling effect is particularly helpful in alleviating discomfort caused by inflammation, temporarily numbing the affected area. Additionally, eucalyptus's anti-inflammatory properties work deeply, reducing swelling around the joints, improving mobility, and lessening pain over time. Eucalyptus oil can be used in various ways. When applied topically, it should be diluted in a carrier oil, such as coconut or olive oil, to avoid skin irritation. Once diluted, it can be massaged directly onto sore joints to stimulate blood flow and relieve pain. You can also diffuse it in the air to enjoy its soothing aroma, promoting relaxation and helping manage chronic pain. Eucalyptus oil is a powerful tool for relieving joint pain, offering both physical and mental benefits, particularly for those over 50 looking for natural alternatives to medication. The third product to consider is peppermint essential oil. Extracted from peppermint leaves, this oil is rich in menthol and serves as a powerful natural remedy for joint discomfort. It is particularly beneficial for individuals experiencing age-related pain. Menthol is well known for its strong anti-inflammatory and analgesic properties. Its cooling sensation provides immediate relief from burning, throbbing, and other pain associated with joint issues. When applied topically, peppermint oil penetrates the skin to reach deeper tissues, reducing inflammation and soothing sore muscles. To avoid skin irritation, it's recommended to dilute peppermint oil in a carrier oil, such as coconut or jojoba oil, before applying it topically. Once mixed with a carrier oil, peppermint oil can be massaged into painful areas, offering quick relief from stiffness and discomfort. Its invigorating scent also has a refreshing effect on the mind, helping to boost mood, especially for those dealing with chronic pain. Peppermint oil is not only effective as a topical application, it can also be added to a warm bath. The steam helps open the airways, while the oil relieves muscle tension and joint discomfort. Due to its antispasmodic qualities, peppermint oil is also an excellent choice for treating muscle spasms or cramps often associated with joint problems. Now, let's move on to ginger oil. This is one of the most effective natural remedies for relieving joint pain, particularly for those over 50. Extracted from the ginger root, this oil is known for its anti-inflammatory and pain-relieving properties. Active compounds like gingerol, shawgale, and zingerone work to reduce inflammation, which is the primary cause of joint pain. These compounds inhibit the production of pro-inflammatory substances such as leukotrienes and prostaglandins, which are responsible for inflammation and discomfort in the joints. In addition to its anti-inflammatory properties, ginger oil enhances blood circulation, allowing more oxygen and nutrients to reach affected areas. Versatile and effective, ginger oil is often used topically. You can apply it directly to painful areas by diluting it in a carrier oil, such as coconut or olive oil, for optimal relief. The warmth of ginger oil can provide almost immediate relief by penetrating deep into tissues to soothe pain. It also relaxes the muscles around the joint, further enhancing comfort. Another effective method is to use a warm compress soaked in ginger oil. To do this, add a few drops of oil to a warm, damp cloth and apply it to the affected area. The combination of heat and the therapeutic properties of ginger oil can reduce pain and improve mobility. Ginger oil can also be used in aromatherapy, complementing topical applications. Its invigorating scent helps diminish the perception of pain and promotes a sense of well-being, making it an excellent option for those with chronic joint pain. Some people even add ginger oil to their bath for widespread relief from joint discomfort. This approach allows the oil to penetrate the skin and relieve multiple areas simultaneously. Ginger oil is particularly noteworthy due to its long history in natural medicine. Used for centuries to treat various ailments, including joint pain, its popularity is supported by modern scientific research that confirms its effectiveness. This makes it a valuable natural alternative to over-the-counter pain relievers. However, while generally safe, ginger oil should be used with caution, especially for those with sensitive skin or during pregnancy. Let's move on to frankincense, often referred to as the king of oils for its healing properties. This essential oil, derived from the resin of Boswellia trees, is particularly effective in alleviating joint pain. Frankincense contains powerful anti-inflammatory compounds, such as boswellic acid, which help limit inflammatory molecules in the body. This action is especially beneficial for those suffering from conditions like arthritis, where inflammation leads to pain and stiffness. By reducing inflammation and promoting better circulation, frankincense supports joint health. Improved circulation delivers essential nutrients and oxygen to affected joints, speeding up healing and reducing pain. Additionally, frankincense is known for supporting the regeneration and maintenance of healthy cartilage, which is crucial for proper joint function. These analgesic effects provide a soothing sensation, making it an excellent natural option for managing joint pain. For those dealing with chronic joint pain, frankincense essential oil is a valuable ally due to its versatility. It can be used in various ways to relieve pain. When applied topically, you can massage the diluted oil directly onto the affected area. The combination of massage and the oil's properties helps reduce stiffness and discomfort. You can also add a few drops of frankincense oil to a warm bath for overall body relief as the oil penetrates deep into the tissues and skin. The calming aroma of frankincense also contributes to relaxation, which is particularly beneficial for those whose joint pain is exacerbated by stress. Additionally, its ability to stimulate the immune system makes it a valuable asset in managing autoimmune diseases like rheumatoid arthritis, where the immune system attacks the joints. Frankincense oil offers numerous benefits, extending beyond temporary relief. It works holistically to support overall joint health. By incorporating frankincense oil into your wellness routine, you promote long-term joint health in a sustainable way. Now that we've covered essential oils, let's explore 3 Ayurvedic herbal remedies that can help alleviate joint pain. First up is ashwagandha, a revered Ayurvedic herb that has also been recognized by modern science for its benefits in managing joint pain and inflammation. Ashwagandha root contains bioactive compounds, such as withanolides and alkaloids, which give the plant its therapeutic properties. The anti-inflammatory effects of ashwagandha are particularly notable, as chronic joint pain is often linked to persistent inflammation, as seen in conditions like rheumatoid arthritis and osteoarthritis. Ashwagandha works by modulating inflammatory pathways, inhibiting the production of pro-inflammatory cytokines such as TNF-alpha and IL-6, molecules that promote and sustain inflammation. By regulating these cytokines, ashwagandha helps reduce joint pain and swelling. In addition to its anti-inflammatory properties, ashwagandha is classified as an adaptogen, a unique category of plants that increase the body's resistance to stress. Since chronic stress can exacerbate inflammation, ashwagandha's adaptogenic properties help balance cortisol, the body's primary stress hormone. This contributes to reducing inflammation by targeting its root cause rather than just masking the symptoms. Ashwagandha is also a powerful antioxidant. Its high concentration of withanolides contributes to its ability to neutralize free radicals, unstable molecules responsible for oxidative damage and tissue injury in the joints. Oxidative stress is a major cause of cartilage degeneration, the smooth tissue that cushions joints. By eliminating free radicals, ashwagandha protects joints from oxidative damage, potentially slowing the progression of degenerative joint diseases like osteoarthritis. Ashwagandha also possesses analgesic properties, playing a key role in pain management. By acting on the central nervous system, it helps modulate pain perception, thereby relieving discomfort from inflamed joints. The holistic approach of ashwagandha, which combines analgesic, anti-inflammatory, anti-stress, and antioxidant effects, makes it a powerful ally in the comprehensive management of joint care. Next, let's move on to turmeric, also known as curcuma longa, which has garnered significant attention in the health and wellness field for its powerful antioxidant and anti-inflammatory properties. These benefits are primarily attributed to its active compound, curcumin. Curcumin is the main polyphenol in turmeric, with significant effects on numerous molecular pathways related to inflammation and oxidative stress. One of curcumin's most remarkable properties is its ability to inhibit the nuclear factor kappa B, NF-κB, signaling pathway, a transcription factor activated by inflammatory cytokines such as TNF-alpha and COX-2. By suppressing NF-κB activation, curcumin reduces the production of these inflammatory mediators, which can alleviate joint inflammation and decrease associated pain and swelling. Moreover, curcumin modulates other inflammatory pathways, notably by inhibiting interleukin-1 beta, IL-1 beta, and interleukin-6, IL-6, two molecules involved in chronic inflammatory diseases such as rheumatoid arthritis and osteoarthritis. In addition to its anti-inflammatory properties, curcumin exhibits strong antioxidant activity, which is crucial in mitigating the effects of oxidative stress. Oxidative stress results from an imbalance between the production of free radicals and the body's ability to neutralize them, leading to cellular damage and exacerbating inflammatory processes. Curcumin neutralizes free radicals and enhances the activity of endogenous antioxidant defense systems such as glutathione and superoxide dismutase. This helps protect joint tissues from degeneration and oxidative damage. Additionally, curcumin plays a crucial role in protecting cartilage by inhibiting enzymes like matrix metalloproteinases, which are responsible for cartilage breakdown. This helps preserve the structure and function of joints. Clinical studies have shown that curcumin supplements can be as effective as non-steroidal anti-inflammatory drugs, NSAIDs, in reducing joint stiffness and pain, while offering a much better safety profile. Finally, let's talk about the third remedy, cinnamon. Derived from the bark of the cinnamon tree, this powerful plant has anti-inflammatory and antioxidant properties, making it an effective means for managing joint pain and inflammation. Cinnamaldehyde, the main active compound in cinnamon, plays a key role in its therapeutic effects. It inhibits several inflammatory pathways, notably by reducing the production of pro-inflammatory cytokines such as TNF-alpha and IL-6. By neutralizing free radicals, cinnamon helps combat oxidative stress, thereby reducing cellular damage and joint degradation. This antioxidant action not only relieves existing joint inflammation, but also prevents future damage. Moreover, cinnamon regulates blood sugar levels, which is crucial as high blood sugar and insulin resistance can exacerbate systemic inflammation, increasing joint pain and stiffness. By stabilizing blood sugar, cinnamon indirectly contributes to reducing systemic inflammation, further relieving joint discomfort. With its anti-inflammatory, antioxidant, and metabolic effects, cinnamon is a valuable supplement for managing inflammation and joint pain. Thank you for watching this video. If you enjoyed it and want more tips on staying healthy and active, please subscribe to our channel. Feel free to comment below which remedy you're excited to try. See you soon in our next video.